Here we are at the minus 80. Minus 80 is usually used for long-term storage of biological samples. So let's say that you have a really special tissue that you want to use and you want to keep it for a long time. In order to slow down the degradation process of tissues over time, you can store it at really, really cold temperatures. And then the enzymes and the proteins that are in there will no longer be degrading, and so you can keep it for longer. So negative 80 is especially used for special samples, while maybe a regular freezer might be used for midterm storage. Minus 80 is used for long-term storage. It's pretty easy to use. The most important things are to remember to have temperature sensitive gloves, such as these ones here. And we also want to make sure that we are in and out of the minus 80 as quick as possible, because every time the doors open, you will be lowering the temperature. And that means that your samples are at risk for thawing or being at the incorrect temperature. So we're going to try to be in and out of here in like 15 seconds. So some of the key things to know about this is like knowing where your sample is stored and having an idea of how the freezer is organized. So we're just going to use this latch here to open it up. And then it's going to be either top or bottom one. Our sample is on the top here. We have several different metal cabinets. We pull one out. We quickly grab what we need or put whatever we need in. Close it. Close up the door. And we shut it and make sure to lock the fridge back up again. That's all. Some other rules for using the minus 80. We'd like to know what's in the minus 80. So please, if you have an idea of what you want to store in there, let us know. You can either let a biolab facilitator know that you want to use the minus 80, and then you have to make sure you store it properly. So that means knowing exactly where it is in the freezer. So that might mean top shelf, second shelf on the top of the top half, on the left, side like that. Give us exact directions of how to get to your sample, and also make sure you label it with your name, your date, and the identity of your sample. And then you're ready to go.